Hi, y'all. It's Bridget Cutshaw with Real Things Living. Today, my guest is Dr. Tasha Golden. She is a speaker, consultant, and international leader in hearts and health, and she has a PhD in public health and has published extensively for the impacts of art and creativity on well-being. She's also the lead author of a book called Arts on Prescription, a field guide for U.S. communities. Can you say hi, Tasha?
Hey, yes, lovely to be here. Thank you, Bridget.
Thank you. And I'm so glad we connected because I think what you're doing is important, especially you're connecting art in health. And I guess the first thing I'm thinking of is my understanding is you started out as an adult as a full-time singer and songwriter, and now you're a health scientist and thought leader in creativity and well-being. So how did that shift happen for you?
Yeah, that I suppose is not the traditional path, like the singer-songwriter to public health pipeline or something. Yeah, I always wanted to be a singer-songwriter from from my earliest memories, I should say. Like I wanted to write songs and travel the world and play them. And so that's kind of everything that I aimed for all growing up. And I did get to do that for several years, touring full time, had songs in TV and film, got to work with some really amazing musicians and really loved that experience. But during those years, a couple things were happening for me that wound up changing the trajectory of my work. And the first one is that I had songs about experiences like my family's history of domestic violence or my own history of depression. And wherever we performed in the world, those were always the kinds of songs that people stayed after concerts wanting to talk about. And they would share their own really personal experiences with things like mental illness or suicide ideation or abuse histories. And many of them would follow that up by saying that I'm the first person they had ever told. And obviously, that was a big honor for me. But I also was really aware of like, oh, if I'm the first person they'd ever told, that means they haven't told a doctor or a therapist. It means they haven't even told maybe a spouse or partner. And I was really aware of how much that communication and sharing of those experiences contribute to our healing. And of course, on a practical level, the things that your physician doesn't know about your mental health history, for example, can prevent them from being able to give you the optimal care or being able to be as sensitive to you as they may need to be. So I was just thinking about what is it about a music venue or about a singer or a song that makes these stories speakable for the first time? And whatever it is, how do we bridge the gap between what's possible in these arts-based spaces and what's not yet possible in these other vital spaces where we need to be able to be ourselves and share our truth? Places like our workplaces, our clinics, schools, even our homes, right? And I saw that same kind of phenomenon when I founded a program called Project Uncaged for incarcerated girls, a creative writing program, and saw the same thing that, probably nobody listening will be surprised to hear that girls share really different information in poems and songs than they share, otherwise in their lives. And so that question kind of stayed with me of what do we not know about ourselves and each other because of what might only come out of us in the space of arts and creativity? And how do we link that knowledge and that understanding and that connection up with the things that we need in order to truly be well in our lives? And I kind of pulled on the thread of those questions until I eventually a winding path, but eventually wound up with a PhD in public health, specializing in the impacts of arts and creativity on our well-being.
I think that's a great pivot that you did because people knew they just knew instinctively that you could help them. That's why they felt comfortable sharing that with you, like you had mentioned that after a concert, people were talking.
Mm.
And I think music in general, there's something about it. We connect with it. I mean, I'm not a scientist like you, but just something about it. It makes you pause and just be in that moment, right?
Mm.
And
Yeah,
reflect.
there's so many kind of like theories that people have around what is going on in our brains and bodies when we experience these kinds of art forms. It does measurably change your brain, your physiology. It can change how you think. And of course, just like socioculturally, there are some really important things that happen that are, even just a simple phenomenon of somebody like me sharing a story about something that's considered maybe stigmatized, or you're not supposed to talk about that. But, in a position like a singer on a stage, you share that, and there's a sense of permission that gives to people to be like, oh, apparently that kind of story is talk aboutable with at least that person, because she's
Right.
she's been through it and she's going to talk about it. So yeah, there's these environments in our lives as humans that we've kind of cultivated over time, and a lot of them are arts and culture centric. These environments where we have decided that it's a little bit safer in this kind of context to be real, to have emotions even. Most of our environments are not places, especially when you think about professional environments, are not
Right.
places where you're kind of allowed to have emotions. So that cuts off, if you think about it, whether intentional or not, that cuts off the sharing of anything that somebody might become emotional talking about, which is, after all, a very big portion of our lives. So when we exclude the possibility, the opportunity, the permission to be fully who we are emotionally and otherwise, we wind up excluding a huge part of the human experience. And humans evolved to make space for that experience in many different ways, including through our creativity.
And where I think being curious too is part of creativity. Is that the right? I think being curious will help. That's probably what,
Oh,
yeah, did that.
yeah.
Yeah,
Say that again.
I said being curious is probably what had a big impact on you. You probably were curious. Why you
Yeah, there are interesting, like even, intuitively we know this, but even studies indicating that kind of like epistemic curiosity, what they might call epistemic curiosity, like what do we know? How do we know it? What exists in the world? Why does it exist? Why is it the way that it is? A lot of that is at the root of creativity. It's why we go try to create new things, imagine new things. Yeah.
it's also, as you're just talking, it made me think when I listen to music, I like to understand the lyrics and try to interpret. That's just me. I'm curious
Mm,
the lyrics. What does that mean? It could be have a different meaning for everybody, a different meaning for the writer, the songwriter,
yeah.
is the right word, sorry. And that's something that I think just I know you also have done poetry too. I think words can be healing. Some people don't believe in that, but I do. And I just
Mm,
think you don't have to share it. I think that's what's happening now more and more this younger generation. Like you said, the stigma is going away
mm.
about mental health. I don't know why. And maybe we always in our culture always had to be perfect, and that maybe that affected us being more mental issues, because we know we're not perfect.
Yeah. And I think sometimes what creative writing can do, or just having access to language, I mean, there's all kinds of, listeners might be interested in the fact that, like, when you experience trauma, there are some studies indicating that the part of your brain that would be able to verbalize what happened to you kind of goes offline, so to speak. And so it's very difficult to put words to what happened to you. So that in those occasions, it might be, you might have better access, or be able to better share what you're going through something like music or dance or visual art that's not so linear. But also having access to other people's stories, other people's words. When you hear somebody else tell a story and you're able to say, which is what so many people told me after shows, hey, that one song that you sang, that's my story too. They didn't need to go into a whole bunch of detail, right? It was like, that story became theirs. They were able to borrow that language, borrow those terms, borrow some of the metaphors. And that's really important for us as humans. Like, we kind of discount these things, but I'm often saying, Bridget, like, we evolved to make and share art for a reason. It
Yes.
does something for us that's essential to our survival. If it wasn't essential to us, we would have stopped doing it millennia ago. And we don't have to understand all of the specific reasons why it's essential to us, to be able to just maybe honor and respect the fact that apparently this is valuable to us. And that can also give us a sense of like, oh, well, when I kind of feel inclined to create, or I feel a little bit drawn to art, or we just find ourselves being responsive to something that's artistic, or, some people like laugh at themselves for like a commercial comes on and there's beautiful music and they're crying. Like your body and mind were designed to respond to that. There's something that you need in that. It's expressing something that's in some way true about the human experience that you're responding to, right? And yeah, so these things like metaphor, analogy, being able to say something without saying it is actually incredibly important for our expressivity, for our ability to understand what we've been through, and especially to share it with somebody else. Because sometimes you cannot and you do not want to say, well, this happened to me first, and then this other detail, and then this other thing, but you still want to communicate that something happened to you. And
Right.
it's creativity and metaphor and image and movement that give us, and sound, music, that give us ways to do that with one another, that help us to be delicate or be forceful, whatever it is that we need to navigate and process around what we've been experiencing.
That is so cool what you're saying. And it when you're sharing this kind of information, it makes people, even if they don't meet you, they're not alone. They understand that they're not alone. And I think that is important to, I'm guilty of in the past, like I could do this by myself. And we really, I mean, we really can't. And maybe that's the environment we're in. It doesn't matter, but we're very resilient as human beings. And I think like you mentioned, your creativity is just helping people find their place in life and kind of to get through it. And I still think it's just, again, the creativity and arts. And you do mostly music and writing. And do you play music, or you're just actually the singer? I'm just curious.
Oh, good question. Yeah, I played piano my whole life and sang and write songs and have definitely loved playing with other people as well. So yeah.
You get a good vibe. I've noticed people who are in our different, we call it different chapter in life. One of our good friends that we met, they created a studio in their basement, and we went over there to go visit them, and they have a drum set and piano.
Oh, fun.
I used to play piano, but I was singing, and it was just like so much fun. I was reading the lyrics they had it on, on the wall so I could read it because I don't know all of it.
Oh,
But
nice.
it's just fun too. We connected with this couple, my husband and I, so much more because we just had this experience. It's not just hiking, I love it, the nature, but that curiosity and the creativity we created together. That to me,
Mm.
I've noticed more people as like I said, different chapters in life, we're embracing arts and creativity more. Do you have what are your thoughts on that? I'm just
I
curious.
think, what you're describing is kind of a really good example of what I find myself talking about a lot as far as well-being, like the association with creativity and well-being. Sometimes when we talk about health in our society, we are often talking about health as kind of this really narrow thing. Like, am I not in pain? Am I not sick? That's kind of like how we think about health. But back in the 1940s, the World Health Organization defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So they literally said both of those things: complete physical, mental, and social well-being, which, like, let's just pause and appreciate that that's a really high bar.
Right, that is
And so
high.
complete well-being and not merely the absence of disease. And all of these years later, like I said, we still think about health as kind of that absence part. And what's really interesting to me is recognizing that health, if we truly define it, is half of it is the absence of disease, if we want to say it that way. Percentages might vary depending on who you are and your values or whatever, but let's say half of it is the absence of things that we don't want, but half of it is the presence of things that we do. That human health has to involve wanting to be here. Like, I often define well-being for myself, in my talks and things like that. When I'm speaking around the world, I get to ask people what well-being is. And I've sort of like brought all of those definitions together
Ah,
into this idea of, like, at the core of well-being, um, well-being is having a life that you want to participate in and feel
yeah.
like you can. And what you're describing with your friends is part of those moments that make us feel like we have a life that we want to participate in and feel like we can. We have people that we want to connect with and feel like we can. Like, there's something that that not only helps us to be able to, like, tolerate and survive being human, which is already a lot, but makes us, like, actually want to be present, maybe imagine a future that we can, like, be part of or help shape. And that is as much a part of health as these things that we're used to thinking about, like, how do I prevent something that I don't want, like diet, exercise, behaviors, genetics, whatever, the things that we worry about. There's also the things of, like, no, what has to be here and be present in our lives for us to actually be well and thrive. Because thriving, sometimes the way that we talk about it is sort of like, if you're surviving, that's health. And if you're thriving, you've somehow managed to get like health plus.
Yes.
And but to be honest, like health involves thriving. That's not something that should be reserved for the people who have a lot of privilege and who are able to make that happen, or it's being given to them or something like that. This is something that all humans, have a right to a life that we want to participate in and that we're able to participate in.
I like that. I like how you brought up the word thriving. Like, I just like that word. It's more positive than to me, the word surviving doesn't sound positive. I mean, you're it's how I interpret those words. But the
Yeah.
word thriving, yeah, I like to say I'm thriving at this chapter in life, right? I'm playing.
Oh,
I mean, right, I'm that's hilarious that you're just making a better connection with other people.
mm.
And it's so helpful what you're doing. And I understand, I mentioned in the beginning you had this, you are one of the authors of Arts on Prescription, and you're going around and sharing this content. So how did this start, this Arts on Prescription project?
Yeah, well, if anybody is wondering, like, what the heck is arts on prescription, it really is exactly what it sounds like. That there are doctors, pediatricians, all kinds of doctors, also social workers, counselors, school counselors, even, who are able right now in different places in the U.S. to prescribe or refer people to arts and culture experiences in their communities to benefit their health. Also, nature, so arts, culture, and nature experiences that benefit your health. And I was I've been interested in this for a long time, of course, because it's related to my research around the effects of arts on our health. And I've always been coming at that from like a systems point of view, like a public health point of view. So not just like individually, what are the benefits of creative engagement? Although I obviously care about that. I've obviously benefited from that myself my whole life. But I'm interested in like, what does this mean for society, for our systems and structures? If art is good for us, what's the so what? What are we going to do about it as a society, as a collective, right? So from a public health perspective, I've looked at ideas like arts on prescription and been like, okay, what are we going to do with that? There's been this idea of what they call social prescribing in the UK and other countries for a very long time, which really just refers to the fact that if somebody comes to a doctor with a health need, it is very likely that they're going to need something in their community to benefit their health, not just pharmaceuticals, not just a
Right.
referral to maybe a physical therapist or something. So there's all kinds of things that people can get referred to in their community. That can be basic needs like housing assistance, maybe job skills training support groups, but also things like volunteering so you can meet other like-minded people, and like obviously, or maybe not obviously, but also arts, culture, and nature. And that's been going on for decades in the UK, for example. And then over here, we have something that's similar called, people call it community referral or non-medical referral, where a lot of you, if you go to your doctor, if you had a need, a lot of your doctors probably do have ways to refer you or your other patients to things in the community, like support groups, housing assistance. But our community referrals are pretty limited in the US, or they have been. We certainly don't have a common situation where people can refer to a cultural experience in the community or arts experience or nature experience, unless it's just the doctor's kind of personal recommendation or advice, right? So there has been a kind of movement to see how we can fill that gap in the US community referral systems. Like, we do have these other assets and resources in our communities that have been proven, for the last few decades with extensive research to benefit humans' health and well-being, but we're not tapping into those via our healthcare systems. And there's no scientific reason why we would not tap into them, right? So in 2020, Mass Cultural Council, that's the state arts council from the state of Massachusetts, launched the first statewide arts on prescription program. And they invited me to evaluate that in 2022. We learned so much about those initial pilots, because it's just people all over the state in really different areas, rural, urban, connecting with different kinds of providers, pediatricians, physical therapists, social workers, school counselors, connecting with lots of different kinds of arts experiences, whether it's a dance studio or play or museum. So because it was so varied, we were able to learn so much. And to their credit, Mass Cultural Council was like, we learned a lot from this evaluation, from this work that we've been doing, the trial and error, the hardship, the benefits that we've experienced. We want people to know about this. How can we create a kind of guide for other communities, other places in the US that want to start something similar? Like, they can stand on our shoulders, right? Like, not everybody has to start from scratch. So we created this field guide to arts and prescription. That was a partnership with myself and Mass Cultural Council and the University of Florida Center for Arts and Medicine.
Oh,
And we just launched it in the fall. And it is an extensive, completely free resource to anybody who's interested. You can be a healthcare provider. You can just be a patient yourself who's like, this sounds awesome. I want this in my community. You might be an arts organization or a cultural organization. But it's not just information about what arts and prescription is. It is really like a blueprint kind of guide for like, here is how you can do it in your community also. And we are so excited to see people starting to take it up. And there are more and more pilots around the US as time
that
goes
is
on.
awesome and beautiful. I'm definitely going to share that information because I'm a totally into agreeing what you're doing here in the United States. I don't know why we're kind of behind uh,
Oh,
on
yeah.
this. And as someone who's experienced some health issues in the past, I was always didn't want to just, no, I don't want a pill for something. That's just kind of how I was, my reaction. I think
Mm,
it's because I stood up and being curious, right? I think it's helped
yeah.
me. I think a lot of people who are open to that, you got to be open to different options. And there's just not
Yeah.
just one solution, right, for whatever
Yeah.
you're dealing with.
And that
It's,
idea of well-being that I mentioned too, that, that it's more that being healthy is more than just the absence of disease. But if you think about, people ask me a lot of times, like, Tasha, are doctors skeptical of this? Are they like, what the heck, arts and prescription? Why am I going to refer somebody to? And I'm always saying, like, I am sure that there is some doctor out there who thinks that this is weird, but I have not met them. Like every physician or healthcare provider of any kind that I've encountered has not only been open to this, but been like, yeah, let's do this. This is a tool that I do not have that I need. Like they know, like think about if you went to your doctor and you were experiencing incredible loneliness in your life. We know that being lonely can be as, have as negative effects on your health as smoking 15 cigarettes,
yes,
a day. And this is a big deal, but what is your doctor supposed to do for your loneliness? A lot of times they will tell us the most that I've been able to do for my patients is maybe give them a bit of advice here and there, or certainly maybe a referral to a therapist, but they can't actually, provide social connections for you, right? But with something like arts and prescription, they can refer you to places in the community where you can go and meet people with like interests or like values, and help you get connected with a community where you can explore something that's meaningful to you. So there are a lot of components of what, make us feel well as human beings that healthcare providers traditionally haven't had any mechanisms or tools to help us manage. And this is really filling a gap in their tool belt, so to speak.
as you are talking, I'm just thinking too, maybe the doctors are feeling, they're burned out too,
Oh,
sad.
yes.
That's why I'm thinking,
They,
they're,
they told us that, yeah, they said,
yeah,
especially since we were doing some of this evaluation like 2022 and like the pandemic, there's just unprecedented levels of burnout. And we heard from some doctors that they were like, they felt better once it was like we were looking at the outcomes for patients and we weren't necessarily looking for providers themselves to be like, I feel better when I am doing this, because not only do I feel like I have more efficacy and can benefit my patients, but it's also it changes the role a little bit. Like one provider had said that, we're often telling people to stop doing something they really like doing or to start doing something they're not really interested in starting to do. And they said, like, this just feels like giving people something that they already want. Like, one person said it feels like prescribing beauty, or just that
yeah,
relationship when like you're giving somebody access to something that they're really genuinely interested in. We heard about one patient in her 70s who left this clinic saying, like, this is my favorite doctor's visit of all time. I got tickets to, I forget whether it was a play or museum, but she was just so thrilled that, she came to a doctor with a problem and was leaving with something that, what made her excited to go out into her day and have that experience with a friend. And I should say this wasn't clear earlier, but when you get a prescription for these experiences, they tend to be free.
right, right.
So like typically when you get a prescription, if you have insurance, that should be covered. The idea behind arts and prescription is that those experiences are also covered.
I like that. I mean, this is just so cool. I'm so glad I'm learning. I've always had this innate interest in what you're doing, and that's probably why I've been drawn to doing something artistic. I'm not a singer.
Mhm.
Oh, I like to pretend I'm singing,
Yeah.
but I'm expressing I should say emotion. Maybe I'm expressing emotions, but positively. And This is so cool what you're doing, this arts and prescription. I
Mm.
have just one more question for you. You had mentioned earlier something about Project Uncaged, that you founded that, right? So real quickly, what is that about, that program?
Oh, thank you for asking. Project Uncaged is a trauma-informed creative writing program for girls that are incarcerated in the U.S. juvenile justice system. And many years ago, I was invited to be a writer in residence for
Oh,
specifically for a girls program in a detention facility in the Midwest. And I I didn't have my own personal experience with justice involvement, so I spent weeks beforehand, kind of like researching um, the justice system, the juvenile justice system in particular, girls' experience in particular, because I knew I'd be working with them, and was really astonished by what I found that, for example, related to gender inequities, the system is still functions on a gender binary, but like, you know, the system was built for, cis het men, like boys, really. And there's a lot of situations where still in 2024, even though girls have been the fastest growing population in the juvenile justice system for a long time,
wow.
there are a lot of facilities where there's nothing for them at all. There might be a facility where boys have a few options of programs to take part in throughout the week that kind of can help them to grow or learn new skills or things like that. And the girls would have literally no options, and that can happen for a variety of reasons. I also learned that girls' pathway into the justice system tends to differ from that of boys. There's, what people call a sexual abuse to prison pipeline. A lot of girls'
Oh,
justice
wow.
involvement is rooted in trauma. And so when I came into that first experience, I was coming in as a teaching artist, as a creative writer. I didn't have experience in health. I didn't have a PhD in health, in anything health related at that time. But I knew that I wanted that experience and that work to be as relevant to them and as meaningful as possible. And so I kind of designed the program around what I had learned, and then also saw some ways where the things that girls were sharing in those environments, I mean, they are the experts in their own experience, right? And they are the people who know best what they would have needed in order to not become part of the justice system. They know best what they need in order to succeed when they leave. And yet so much of their knowledge isn't being heard and shared by people who make decisions about them. So I saw some unique opportunities to work with them and their knowledge and give them more platforms for that. So I wound up creating my own program called Project Uncaged, and we publish books of girls' poems with their permission, of course,
Oh,
and
that's
send those to, like the mayor's office, to city council members, to state legislators and secretaries, along with policy briefs that are like, here's what you're going to read about in these girls' poems. Here's what's going on in their lives, and here's what you can do in your role in order to make a difference, to change resources, to change opportunities for them, and kind of marrying what I described earlier, that, what is possible to share and understand in the space of the arts, and what's not yet being understood or shared or responded to in these other places, and how can we create um, a bridge for that work. And I will say, the writers that I've had the privilege of working with over the years have been my greatest teachers about, about what well-being is, for example, about what it means as a collective to care for one another and reimagine our systems, and how we do, how we how we move forward as a society and what's possible. It's just been, they really are amazing teachers, and it's so important to give them a platform to share their wisdom.
that is so beautiful. You're very inspiring, and I like how you're focusing on what well-being really means.
Mm,
I really like this because I know some people find like, I've talked to some people about that, but they need to probably explore it a little bit more. Is that the right word? It is just so cool what you're doing. I am very inspired and motivated. I'm going to definitely. I was aware of Arts on Prescription, but not really Project Uncaged. I want to look at that, and I think you're using your personal experience to help others. That's really what it is. You're putting out some good positive
mm.
vibes that we need in our world. In
Well,
our world.
I should say, Bridget, that I didn't mention this earlier, but part of my story, of going from being a singer-songwriter to doing the work that I do now, like part of that path goes through catastrophic burnout and major depression,
Oh,
where
yeah.
um it was a kind of combination of the grind and hustle of the music industry. That's a lot for anybody
Yeah.
with, that space that I was holding after my shows night after night. It turns out I was really honored to do that. I still am. But at the time, I didn't know how to hold that space for, listeners while also taking care of myself. And it, just wore me into the ground eventually. And so there was a long period of time when I couldn't get out of bed, let alone
Oh,
imagine
wow.
playing a concert. And I had to fully reimagine, like, well, this is all that I've ever wanted to do, is be a singer-songwriter. If that's not what I'm doing and not who I am, then what am I? What am I doing with my life? I didn't know what a future would be or if I wanted it, right? And so when I say that well-being is having a life that you want to participate in, that's coming from a person who had a significant period of time when my life was not something I wanted to be in. And I'm getting emotional talking about it because that is a visceral experience if you've had that experience. And I imagine that a lot of listeners have, right?
Right.
And so it's really important to me to that ability to imagine, to get yourself to a point. This is what I work with a lot of clients on too. Like, how can we get ourselves to a point where we can reimagine what we've accepted to be true?
Yeah.
I said before that, like, I thought of myself as really creative. I was an artist. I was making my living as an artist. But as it turns out, I had one story that I knew how to tell about myself, which is that this is the job I have. This is what I do. This is who I am. And once that story wasn't available to me anymore, I lost everything, right? And so for me, I think that the biggest link sometimes between creativity and well-being is being able to know how to question what we've accepted as just the way that things are. For my own life, this is the way that my own life has to be. This is the way that the world is and has to be. All of these things can be reimagined. And that's the biggest, I would say that's maybe the most crucial creative work that any of us get to do as humans, is to reimagine who we are, to know that that's a story that we're always still writing, right? It's never finished till we are, and that we get to participate in that with other people too. How do we reimagine the world and recreate our systems so that all of us can truly be well?
I think you're going to make a great impact. It's going to have a ripple effect for others, right? You might not always have a direct connection with every person you're going to help, but I think I like the ripple impact. It's really beautiful. I am just in awe of what you're doing, and I'm clapping in my brain like she is just awesome.
Thank you.
Tasha is awesome, and this is so cool. Where can people learn more about you, Tasha?
Oh, I've made a custom website for listeners of this show. If you want to go to tashagolden.com/realthingsliving. So tashagolden.com/realthingsliving. And you can get there. I'll make sure there's a link to that field guide to art on prescription for you if you want to download it. And then also maybe another couple resources around well-being and depletion, especially if you're a creative or you want to be, a couple resources there that could be helpful to you.
That is so beautiful. I really appreciate your time and you creating that link with real
Yeah,
things
yeah.
on there. For those that are listening, I'll include that link in the description. And thank you again so much, Tasha. I want to definitely talk to you again. This is just awesome.
Oh,
Awesome.
thank you so much for having me, Bridget. Thank you.
Thank you again. I'm so excited.